My name is Aymardo Babasimon Luju, and thank you for the opportunity. Now I'm going to explain about the danger of HIV/AIDS. So, did you know that HIV has been a significant public health concern for several decades and has affected millions of people worldwide according to UNAIDS? There are there have been 40.1 million people died from HIV and AIDS related illness since the start of epidemic in 1981. According to hellodoc.com, HIV, which stands for Human Immunodeficiency Virus, is a virus that attacks the immune system, leaving the individual vulnerable to other infection and diseases. AIDS, which stands for Acquired Immunodeficiency Syndrome, is the most severe stage of HIV infection. Led to considerable advancement in HIV prevention and treatment, the virus still poses a serious threat to world health and must be eradicated through continued work in areas of education, prevention, and treatment. First, I will discuss the cause of HIV/AIDS, followed by the ways of which the virus is transmitted and the symptoms of HIV/AIDS. Continuing, I will discuss the available treatment option of HIV and the importance of raising awareness about the disease about the disease. And finally, how to prevent getting infected by HIV. Without any further ado, let's start with the first one. Okay, the cause of HIV. HIV is caused by a virus that attacks the immune system. The virus can be constructed through several means, including unprotected sexual contact, sharing needles, and mother to children transmission during pregnancy, childbirth, and breastfeeding. According to the World Health Organization (WHO), HIV can also be transmitted through blood transfusion and organ transplantation from an infected donor. Next one is transmission. HIV can transmitted through sexual contact with infected person, also sharing needles or other drugs injection equipment with an infected person can also transmit the virus. And like all like I've explained before, mother to child transmission can occur during pregnancy, childbirth, or breastfeeding. And also, HIV can also transmit it through blood transfusion and organ transplantation. And the symptoms that caused by the all of the transmission is is a flu-like symptoms including fever, headaches, and fatigue. As the virus attacks the immune system, individuals with HIV are susceptible to other sorry uh, individual that's susceptible to other infection and illness, including pneumonia and tuberculosis. According to Center for Disease Control and Prevention, CDC, individual with AIDS may experience severe and life-threatening illness, including cancer and neurological disorder. You've already aware of the cause, transmission, and the symptoms. And if you experience them, you may you may get tested for HIV and learn about the treatment option. But there currently no cure for HIV or AIDS. How's that? But but there are antiretroviral therapy, or for short ART, can help manage the virus and reduce the risk of transmission. ART is a combination of medication and that target different stage of HIV life cycle. According to WHO, ART can help individual with HIV life sorry. According to WHO, ART can help individual with HIV live longer and healthier life. HIV positive pregnant women can also receive ART to prevent mother to child uh, transmission during pregnancy and childbirth and or breastfeeding. Now, when you know all of these, you should know how to prevent yourself from getting HIV. So, for us college student, we have a higher risk of con- contracting HIV due to factors such as increase of sexual activity, drug use, and exposure to new sexual partners. The stigma associated with HIV/AIDS may also discourage sorry, may also discourage some college student from seeking testing or treatment. The key methods of HIV prevention, the first one is practice safe sex, including the use of condoms and dental dams. The second one, avoiding sharing needles or other drugs injection equipments. The third one, get tested for HIV regularly and encourage partner to do the same. The fourth one, take pre-exposure prophylaxis medication, which can reduce the risk of contracting HIV. Use and lastly, use sterile equipment for tattoo, piercing, and medication procedures. In conclusion, HIV/AIDS is a complex disease that has affected millions of people worldwide. It is caused by a virus that attacks the immune system and can transmit it through several means, including unprotected sexual contact, sharing needles, and mother to child transmission. HIV HIV infection often cause flu-like symptoms, and individuals with HIV/AIDS are susceptible to other infection and illness. While there is no currently while there is currently no cure for HIV, antiretroviral therapy can help manage the virus and reduce the risk of transmission. It is essential to it is essential to raise awareness about HIV/AIDS and promote prevention and treatment options to reduce the impact of the disease. Although such Although there have been significant advancement in HIV prevention and treatment, the virus still possesses a severe danger to global health and need to be eliminated via ongoing efforts in education, prevention, and treatment. HIV prevention is critical aspect of managing spread of the disease. Testing, prevention, and treatment are the key promoting HIV/AIDS prevention and reducing the impact of the disease. I encourage each and every one of you to take these steps and play the role of preventing the spread of HIV. And I want to uh, explain a quote by a person that we all know. It says that HIV does not make people dangerous to know. So you can shake their hands and give them a hug. Heaven knows they need it. And the quote's by Princess Diana. That's all for my speech, and this is my reference. My notes. Uh, yep, that is my notes for my speeches. Uh, yeah, that's it. Okay, thank you.